Chairman. Ray Joyce, McLaughlin, Beston,
Here.
Petto, Miller,
Present.
Robinson, Lane,
Here.
Collins,
Here.
and Lockhart. You have a quorum.
Let's start with, we can't approve the minutes.
Yep, there was a Granicus issue with approving the previous minutes, so we'll just take care of that next month. Items 2 and 3 are withdrawn. For items 4 through 10, we would like to have a motion to group.
Beston, second by Mrs. Lockhart. Outstanding. All in favor?
Aye. You ready for
Dr. Giordano, yep.
Good evening, everybody.
Well, I so we are grouping as suggested, items 4 through 10, so if you could talk about those generally.
Sure. I'm here with Deputy Director Hoffman and Associate Director Fitzgerald, who you've probably met. Items 4 through 10 are, well, let me just say, each year I come before you presenting our state aid contracts from OMH and OASIS. This is the manner in which both of those state agencies get money into the communities. This is the same process in every county in New York State. The Department of Mental Health is designated in the mental hygiene law as the local governmental unit, and we have 100% state aid funding that's passed through us to agencies. This first grouping is the OASIS agencies, and what we're requesting is to enter into contract with 7 agencies as indicated for the 2026 year.
Any questions? Any questions from the committee about any of these 4 through 10? Motion, Ms. Lockhart, second Mr. Beston. All those in favor?
Aye.
Opposed? Motion passes. Thank you. Number 11.
We would also like a motion to group 11 through 14.
The motion, Mr. Beston, second by Ms. Lockhart. All those in favor? Aye. Opposed? Motion passes. Thank you.
Thank you very much. The items 11 through 14 are part of a request to amend the 2025 budget. These are COLAs for the 4 agencies that were identified through the Office of Mental Health. And again, this is 100% state aid that is passed through to us. And we learn about these increases at different points in the year. This is the first opportunity we've had to be able to come to you on those.
Any questions on 11 through 14? Yes, Mr. Collins. Motion, Mr. Collins, second by Mr. Lane. All those in favor, please say aye. Aye. Opposed? Motion passes. Thank you.
And lastly, we would like a motion to group for items 15 through 22.
Okay, this is great. Motion for Mr. Beston, Ms. Lockhart, second.
Thank you very much.
All those in favor?
Aye.
Sorry.
Oh, for the group, yeah, you're right.
Yeah.
Sorry.
Yeah, sorry, go ahead, Stuart.
No, apologies. So this grouping are the Office of Mental Health agencies that, once again, they're state aid funded. I should add that there are many other programs in the area that bill for their services, clinics that bill Medicaid, that insurance companies. These programs that I'm talking to you about tonight, both in OASIS or OMH, are in need of state aid funding because they're not able to bill for what their services they provide. So there are other OMH agencies operating in this region and this county other than these. But we are also asking permission to enter into contract in 2026 for the 8 agencies that are identified there.
Any questions? Dr. Guido?
Could you state out loud the agencies
Sure.
that you're mentioning?
Sure. Whitney Young, they operate a health home. Unity House, which took over Northeast Career Planning in Manans, with education and mental health program. RSS, which has a big footprint in the Hudson Valley and in Albany County as well. They run a host of housing outreach clinic programs. That's rehabilitation support services. Parsons, which is the premier child mental health agency in town. Homeless and Travelers Aid, which they provide in addition to all the many things they do that are not involved with OMH, supportive housing and outreach. Equinox, longstanding partner in the community. CAPS is what does CAPS stand for?
Capital Area Peer Services.
Capital Area Peer Services. That's pretty good, wasn't it?
Good, yeah.
Too nice.
And they are an advocacy organization run by people with lived experience, like a drop-in center, a warm line, among some other things. And then our DCYF mental health programs are also part of that is state aid funding for the single point of access. So those are the mental health programs.
Thank you.
Yes.
Anybody else have a question? I do have one question too, sort of generic question. Most of these, I think, are all the ones we grouped from the beginning on, they're all repeat programs, correct?
Yes,
There's no new programs, I don't think.
yes, indeed.
And then, but I know in the budget, we're looking at some new programs in the next budget year, new programs are starting. I know you guys, like every other department, has staffing issues. Are we able, how is it going with that aspect in terms of all these programs, new programs we're doing with the staff? Are we able to staff those, and how's that turning out?
Well, so that's a very interesting question, but I'll just remind you that all of these programs that I'm mentioning tonight are run by community agencies.
Perfect.
I think we're all struggling with the same workforce,
Yeah.
but, and we hear from all of our partners in the community that they are struggling. But they're all,
These are all outside agencies, so that's.
they're all outside agencies.
So
and
we don't
they're
have the other
all-
ones that we do, and stuff that you guys want to do?
Well, I'm excited, as I said actually it was in the Audit and Finance Committee, that we've actually hired 23 individuals in the last 6 months, which is, we're really pretty proud of that. And one of the ways we've been able to do that is with the support of the county exec and the Department of Management and Budget and you guys. We've been able to add some career trajectory by adding level 2 positions, mid-ladder positions to increase career trajectory within our department. And that's really helped, as well as a lot of canvassing. One of the areas we still struggle probably the most with, though, is mental health clinicians, surprisingly. And that has to do with the fact that the regulatory agencies require a certain level of education in order for the programs to operate. But they are working on some paraprofessional degrees, which, over the course of time, we'll be, I'm sure, speaking to you about those. And we're adding as many direct level positions as we can to help with the issue.
Okay, awesome. Thank you very much, I appreciate it. Any other questions? A motion to approve, please. Mr. Best, second by Mr. Lockman. All in favor, say aye.
Aye.
Those opposed? Motion passes, thank you.
Item 23 is amending the 2025 Department of Mental Health budget for psychiatric care.
Right, so this is our psychiatric group for our internal services that we provide. And again, if I could just go back to your last question, we are not unique in this, but not every county does it this way. We both provide direct care through a host of our own Albany County mental health programs, and we contract with outside agencies to do. There are almost 70 individual programs in these agencies that I just mentioned. So there's a lot of things that we can't do, but we do also a lot of things that they don't do internally. So our psychiatric group is the Psychiatric Group of Albany. The nuance here, the reason we're coming back to you is that the 3-year renewal contract was finalized in terms of our negotiation after we submitted our 2025 budget, and there was an increase in the final negotiated contract. We knew we were going to have to come back to you at some point. We waited till now because we watched the utilization pretty carefully of our psychiatric services, and we wanted to wait until we saw exactly how much was needed to ask you for. And that's the $220,000 we are certain, fairly certain, will get us through the end of the year providing the services. But the contract was increased early in the year, and the rates were increased. We didn't come back to you until we had a better projection as to what we would need. And I will just tell you, the last time we talked about this contract, there's about a 75% on average return on investment. These are billable services. We collect revenue as a result of the work that these psychiatrists do.
Okay. And
So we're
obvi-
asking to amend the 2025
Yep.
contract.
And obviously, I was gonna ask, but it's coming from inpatient hospitalization, so you're comfortable with what you have in there for the rest of the year? I would think that's,
Yes,
okay, all right.
yes,
I mean, yeah, I wouldn't think you'd take it from there otherwise, so, but,
yes.
okay, all right, Ms. Lockhart.
Kind of along the same lines as your question, Mr. Chairman. Taking from the inpatient psychiatric hospitalizations, should I infer that hospitalizations are down? That you don't need that money in that line?
I would not infer that, but what I would say is that, we've talked about this before, these are the forensic psychiatric hospitalizations that are the result of the not competent determinations that we make
Right.
in the courts. We get billed for that on a lag.
Okay,
Right now, we believe that we are good and that money is there to be moved today. And we believe that the final 2.5 months won't exceed the amount, but I can't promise you that I won't see you again on this.
do we get any reimbursement from anybody for that?
No, that is and again, this is, I was just at a conference with all of my 57 counterparts around the state. That topic was one of the top concerns every
Okay.
county is suffering with. We've told you before, about 5 years ago, the governor decided to make this 100% county cost as opposed to 50%. It was always a hefty bill, now it's much heftier. We don't get reimbursed. This is a unmandated or mandated,
Mandated unfunded.
unfunded mandate.
Because from our discussion before, my understanding was that a lot of these forensic hospitalizations are going up because defendants are seeing that as a way of averting from jail. We were
well-
talking about that at one of our committee meetings.
It's not the defendants as much as their defenders.
Well, same thing.
They're
Their
court.
attorney's doing it on their behalf.
Yeah, but I will tell you that, we keep pretty good statistics on this, and the numbers that are referred for examination that are found not to be competent is pretty high, so,
That makes me feel better.
well, and 2 examiners have to do.
If they're sick, they're sick, but if they're not.
If they're sick,
no.
they're sick. 2 examiners have to do independent exams, we hire them too, and they're finding a high level of not being competent legally.
Surprise. Thank you, thank
You're
you,
welcome.
Ms.
Jeff.
Betta?
Thank you.
Thanks, Chair. This street psychiatry program is separate from this
Yes.
line, of course, but what is our investment in that, and do we get New York State reimbursement on that?
I certainly wasn't prepared to answer that question this evening. I can get that information
Yeah.
for you.
That has some reimbursement for that
Well,
program,
we hope
doesn't
that
it?
there'll be billable services that are provided, but I would not want to necessarily get into that right now.
You can definitely send that to us if you
Yeah.
have it, thank you.
Thank you.
Mr. Lane, do you have a question? Okay, any other questions? Okay, motion to approve. Mr. Joyce, second. Mr. Collins, all those in favor, please say aye.
Aye.
Opposed? Motion passes.
I appreciate it very much.
Thank you.
Thank you very much.
Thank you for approving those, really appreciate that. 24.
Item 24 is amending resolution number 384 for 2022 regarding the 2022 State Homeland Security Program. Dr. Matt Wright is here.
Hi, good evening, everyone. So I have Ransom Moore with me here, our Assistant Commissioner for Finance and Administration as well. So number 24 is a request for authorization of a term extension of the 2022 State Homeland Security Program grant to extend it to August 31st, 2026. This one-year extension will allow the Health Department to complete its projects that support efforts to prevent and respond to terrorism and other catastrophic events. These projects include things like our Medical Reserve Corps volunteer recruitment campaign, as well as purchasing of supplies to support these response activities. All of the identified opportunities to spend the remainder of that grant have been identified, and we anticipate making all of those purchases within the year.
Any questions? Question? You have a question?
Is this the first extension of this particular?
Yes, so the grant, it's a 3-year grant. It ended in August 31st, 2025. So this will extend it, allowing us to spend the remainder.
We got motion? Second by Mr. Joyce. All those in favor, please say aye.
Aye.
Aye. Opposed? Motion passes. Thank you. Number 25.
25 is authorizing an agreement with Impact Marketing and Communications regarding an opioid public education campaign.
So this request is for the authorization of the Department of Health to enter into a contract for an opioid public education campaign with Impact Marketing and Communications. It is funded by the opioid settlement funds, and the contract will not exceed $150,000. For background, an RFP was conducted, and after a thorough evaluation of the proposal submitted in conjunction with the Department of Mental Health colleagues, Impact Marketing and Communication was selected. The campaign will be designed to increase public awareness of opioid use disorder, reduce stigma around opioid use disorder, and promote widespread access to resources for prevention, intervention, and treatment. The campaign is expected to roll out over a 12-month period and include various public engagements, including social media and website materials, traditional media platforms, as well as various community engagement strategies, including but not limited to community ambassadors and partnerships with local organizations. They'll leverage a combination of creative as well as data-driven outreach and ensure collaboration and cultural competence are central to all aspects of the strategy. So I'm happy to take any questions if you have them.
Questions from the committee? All right, motion, Mr. Joyce, motion moved, second?
Second.
Ms. Betta, all those in favor? Aye. Opposed? Motion passes, thank you. I believe that's in the
There are
agenda.
no further items.
No further items, motion to adjourn, please. Ms. Lockhart, second by Mr. Beston, in favor? Aye. Thank you very much. Thank you for your time.